People living with HIV/AIDS can die within weeks of acquiring TB. But this lethal combination can be dealt with through early detection and treatment. The standard TB treatment regime costs as little as $12 but can prevent death, especially among patients who are not yet on antiretroviral treatment or ART. ART for HIV/AIDS along with TB treatment can be administered together if needed, although care has to be taken to ensure that the two drug regimes are combined properly to prevent adverse drug interactions. But a more concerted effort is required by all stakeholders. The most urgent among them is the political will to integrate HIV and TB programs in a practical way. A beginning has been made by an active group of MPs in United Kingdom who have come together to form the world's first all-party parliamentary group for advocating issues of tuberculosis. And they have travelled around the world, including India, to help form an international wave of support for TB.
I think there's a lot that the HIV/AIDS world could learn from the approach used in tackling TB. I think because of the co-infection rates.
What I think we need to do, both with HIV and with TB, is see what can be done in an imaginative way to try and support treatment and identification and so on through communities. What can be done that can be put in place very quickly and easily, building on community structures that are already there, as opposed to having to develop complex Western style health provision, which takes a long time, a lot of money, and a lot of trained personnel to put in place.
Solutions will come from a strong national as well as international response. In 2004, 29 of the 41 high-burden countries had national policies on HIV and TB. This needs to be scaled up. India already has 100% coverage for TB treatment under DOTS and is now in the process of implementing a national plan for TB/HIV co-infection. The challenges are many. If the world has to meet the target of cutting deaths due to TB and HIV/AIDS by half by the year 2015, it can no longer ignore this deadly partnership between the two diseases.